My name is Aliea Herbert. I'm a cancer rehabilitation physician, and that means that I'm a rehabilitation physician, but I see primarily cancer patients. Rehabilitation physicians work with patients who don't move like they used to or like they want to for lots of different reasons. Some rehabilitation physicians focus on patients who have back pain or have had strokes or amputations or some other reason that impacts how they move. And I specialize specifically in patients who have a change in their function based on something that involved their cancer treatment, their chemotherapy, radiation, or surgery that might affect how they move. One of the reasons I chose to work in rehabilitation was this feeling that you get when you're really moving into flow states. And when I was working in rehabilitation, I realized that there's people who have many different limitations to their movement or their function that still really appreciate accessing those things like flow states. For many of my patients, what we're looking for is this feeling of joy and satisfaction and fulfillment in your life. And that's the whole reason why you're going through treatment for cancer, is to find all these wonderful aspects of your life and enjoy them. And so helping patients access that and find that again in a really difficult time is hugely rewarding. Patients who come to see me, I always review all of their records first. So I'm familiar with their oncologic plan, their radiation plan, their surgical plan, and I work closely with most of their team members, so with their surgeons and their radiation oncologists and their oncologists to understand what their treatment has really involved. And then we work together to discuss, well, what are your goals and what's really impeding you from reaching your goals? So for most people, we're really looking at how do you find joy in your everyday, right? What is getting in the way of finding that? For some people, it's pain, and we focus on aspects of pain and sort of unravel what we might be able to do to impact that. Specifically, for example, patients who have breast cancer, they might have pain related to their radiation or their surgery or their chemotherapy. And there's specific things that we can do to address different aspects of that pain. Cancer rehabilitation is a piece of a suite of services that are really nested within supportive care. So I think that the team environment that we have working alongside oncologists, radiation oncologists, and surgical oncologists, all to provide the best supportive care to patients going through their cancer treatment, is a great aspect of working at Swedish.